President's efforts will ensure not only that we get vaccines, therapeutics, and diagnostics.
COVID-19 diagnostics, therapeutics, and vaccines.
Largement du développement et du déploiement rapide de diagnostics, vaccins et traitements efficaces.
Universal access to vaccination, treatment, and diagnostics.
Equitable access to new COVID diagnostics, therapeutics, and vaccine.
We must all work together on improving diagnostics, accelerating therapies, and ultimately developing a vaccine.
We need to make vaccines, treatment, and diagnostics accessible to everyone.
Vaccines, treatments, and diagnosis will be the most effective way to do it.
We need new diagnostics, vaccines, treatments, and an equal distribution to all.
On equitable access to diagnostics, treatments, and vaccines.
And affordability of the vaccines, therapeutics, and diagnostics.
In order to develop adequate treatments and vaccines.
Better diagnostics, treatments, and a safe and effective vaccine.
Hello there, welcome back. Thanks again for joining me, and thanks again for giving up some of your time to hear what I have to say. As always, greatly appreciated. So here we are again doing more SARS-CoV foolishness as it continues. I want to get quick on this one. I tend to prattle on a little bit too much, so I'm actually going to start reading from slides. I think that will keep me a little bit more focused, and I want to keep this one down to, well, 10 minutes, which means it's going to be at least 20. Sorry about that. So as with all of these videos, I like to state up front the intentions and where I'm coming from and that kind of thing. In this particular video and a previous one, it's a of analysis and social commentary. So as such, some terminology used may seem non-empathetic. I am not without empathy towards any and all who have suffered and or otherwise been negatively affected by whatever SARS-CoV-2 turns out to be. This is an analytical presentation, and as such, emotion needs to be set aside for the time being. You know, some of the term when you talk about numbers and deaths and things like that in a cold calculating way, it can come across well, like that, cold and calculating. Also, as always, in this context and anything else, if you want to wear a mask or any other PPE measures, then you also should have the liberty to do so. Whatever you want to do is up to you. Pushing that onto other people, that's where the problems become more acute. And just to give a bit of a context for the overall presentation here, whether SARS-CoV-2 is or is not a virus, is or is not a natural thing, was or was not intentionally released, if there is such a thing as virus, and so on. These are all topics for another day. I hope to actually look at that because there seems to be a lot of controversy about it. So ideally we take a peek at that as well. Just a reminder about correlation does not imply causation. In statistics, the phrase correlation does not imply causation refers to the inability to legitimately deduce a cause and effect relationship between two variables based solely on the basis of an observed association or correlation between them. So this is basically cause and effect. A couple of examples to make that point. So here we have the number of people who drowned by falling into a pool, and then correlating with the films that Nicolas Cage appeared in. So, you know, there's very little chance of being a cause and effect there, although they do correlate. Same here with hanging, strangulation, and suffocation suicides, connecting up with U.S. spending on science, space, and technology. So a good chance of that correlation. Sorry, of the causation there, not really, but a good example of correlation. Propaganda is also something that always have to keep in the back of our mind these days. It's just got worse and worse and worse. I mean, it's been around since forever. You know, we even use it at home with your parents, you know, more so when you have more siblings, although we do it as an individual as well. But, you know, you get the, you know, even the siblings gang up on the folks and keep beating them down because you want to go to this particular place or that particular place, so on and so forth. And you pitch it and all that kind of stuff. That's, you know, in a sense, it's a set of propaganda. It's a type of propaganda. But it's just gotten way out of control now with governments and, you know, being puppeted by or parroted by media. So I don't want to get into too big detail on this because I have many things to cover, but I encourage you to read these little sections here, pause and read through, but the part that I've underlined here is the part that I want to kind of focus on. Just to make a point anyway, focusing on. To maximize effect, they may omit or distort pertinent facts or simply lie, and they may try to divert attention of the reactors, the people they're trying to sway, from everything but their own propaganda. So we would be the reactors, the average Joe and Josephine, would be the reactors, and they try to sway away and keep eyes on whatever they want us to keep the eyes on, whoever they may be. This is a very interesting section here. I encourage you again to read it all, but education aims to induce reactors to collect and evaluate evidence for themselves and assist them in learning the techniques for doing so. This is important and critical overall, but again, I would encourage you to read that whole little section there. It's pertinent and interesting and enlightening. So despite the best efforts of the media and government, we need to change the narrative away from cases. A positive test result does not mean the person is sick, will get sick, or has the potential to be a viral shedder that can affect others. And the term case plants a generally potentially negative assumption in people's minds. And then the number of individuals requiring hospitalization, that's not the ones just showing up because they think they do. These are the ones that actually are requiring hospitalizations as determined by the FAR or the hospital side. That's a much better barometer of any threat, including this one. And our bottom line here is, with the exception of the always present outliers, the fatality statistics are all that really matters at this point. So let's keep on moving through here. We'll start with Canada. And this video was sparked by both Trudeau's comments here and Christine Elliott's comments. Actually about a day apart, or maybe even on the same day. Anyway, Trudeau here is with we are still living in an emergency. And while that part is true, he's neglected to state there that, the emergency is that they created it, with we being the government group of Canada. So a public health emergency, however, we are not. And it's becoming clearer and clearer by the day that it never was outside the usual high-risk population, particularly the older generations and long-term care and retirement residents. So let's start looking at some of the numbers that you just don't see on the media because they don't talk about this for some reason. So we're using a population of 37 million. It's just kind of a nice round number. It's close enough. And the total cases here in Canada is 134,294 at the time of making this video. So that gives you an infection potential of just about 0.4%. 1%. Oh boy, that's statistically insignificant. The other interesting thing to note here is how the whole that number is what's pushed, the 134,294. But the reality is, take the recovereds out, because in many cases these are people that were never sick in the first place. They had a very mild thingy, and even ones that were in severe illness, recovered and out. But it makes for a nice dramatic number, doesn't it? So instead of just focusing on what would be the active, the 6868, and the fatalities, the 9155, which again, even putting those together is a substantially lower number than the 118,271 or the 134,294. So yeah, you can see why they use this number. It's very dramatic. So let's examine this a little bit more. We have the total cases of 134, as mentioned, 294. Our total fatalities is 9155. So your fatality potential in terms of the entire population is 0.03%. Again, statistically insignificant. That's not even a rounding error. That's not even worth anything. But if we take it just with the cases, so outside the general population, now we suddenly jump up to 6.8%. Which again now is a little bit scarier number, but when you look at it a little closer, not really. We can see where the cluster of fatalities were, the 60 to 69. It's a rough go here because this is a questionable age group. We don't really know how many people were actually 68 and 70, and there's probably not that much difference in terms of body mass between these two, or body situation. But anyway, suffice to say, we'll use the 60 group as the high risk group. I prefer to use 70, but that's okay. Well, this is the way they've got it recorded. So we can see here from 60 and down, up in this case, this is where they're all concentrated, in this area. Now, not only on top of that, we have this portion, which is the long-term care and seniors. These folks do not circulate in the general population, and although we've got some vectors in through staff, there's infectious control procedures in place. I know I helped to write some of them when I worked in this industry. And I'm well aware of them. And there's a reason for them to be there, right down to the common cold. They're not desired in those homes because they are a vulnerable population. So they also don't circulate in the general thing is mentioned. They don't circulate in the general population. So for the sake of analysis, we can actually remove them from the big picture. And so we have the total fatality of 9155. Well, it's removed the 6744, and we're left with now a fatality number in the general population of 2411, so 2,411. That changes our fatality potential to 1.8%, which is significantly lower, especially when you're dealing with a large population or even a large case number. Statistically lower, significantly lower than the 6.8 previously seen, and this is more of a realistic number. So that just again shows that these are statistically irrelevant. This is taken from one of the weekly updates from the Government of Canada, and it was the closest one. There's a bit of a lag time in getting them put out there, about a week and a half. So this is from the 23rd to the 29th. We had 42 deaths reported in Canada, again in a population of 37 million, and it represents an 11% decrease from the previous. And then underneath, following a steep decline of reported deaths in early May, the number of new deaths reported daily has remained low, with the average of 6 deaths reported per day this week. That is, again, an insignificant number. Keeping moving on here, we look at it as a chart, and you can see we're exactly what they're talking about. Basically, May was the last ditch effort. Interestingly enough, most of the social stuff had been well into place in the mitigation measures, and yet still, even though fatalities are a lagging indicator, well, we were shut down way back in this section over here. So how far is the lag going to go? Like, this is ridiculous now. We're talking months instead of weeks. But nonetheless, there was a fluctuation here, and it had something to do with Quebec as well in this particular regards. But basically, we can see the whole thing dropping, even with the smoothing curve. Even without the smoothing curve, it's still flat. And so here we have the cases. So we still have a kind of steady case number. Interestingly enough, you can see these pulses. If I looked a little closer, I'll bet there's close to the weekend dates or Mondays and stuff like that. But nonetheless, we can see where we had a kind of a steady low rate. Not massive amounts, but steady low rate, and yet we still have the declining death rate. We have the declining hospitalization, the declining ICU, like everything is declining. The case rate's going up, but of course, keep in mind that when the testing rate goes up, as we'll see further on for Ontario, of course you stand a better chance of having more positive tests. That's just the way things will roll. So here's a weekly death count for Canada, and it's from 2014 to 2020, the dotted line being the 2020. And we can see that bulge there in April, and that's the recorded deaths in the old age, generally speaking, in the long-term care. But that's basically when the bulk was, and it dropped right off. Now that will be subject to some adjustments and some smoothings, and so by the time the data is all updated, I would bet we'd see that settle into one of those, or close to one of those existing patterns already. Here's a document from the Daily, which is a StatsCan kind of publication they put out. I believe it's daily. I haven't actually checked to see if it was daily, but it's called the Daily, so one would assume that it's daily. This was the 28th of August of this year. And it talks about excess mortality, so that's just the mortality over and above what one would normally expect to see in a certain time frame based on historical evidence. So it's an interesting document to read. I encourage you to read all of this stuff the best you can, and even more if you can possibly get at it, but we will just focus in on the pertinent details. So this just talks about here that this is releasing provisional death estimates, which have been adjusted to account for the incomplete nature because of reporting delays. They really haven't had the up-to-date, so they're attempting to adjust. So I'm sure there's a little bit of, I don't want to call it fudging, but there's going to be a little bit of guessing per se, but they're using the data to bring this up to snuff if they can. And so in the first 2 months of the pandemic, there were more excess deaths than what was reportedly attributable to COVID-19, according to the new provisional death estimates. That would make sense. For sure, but the problem I have with this, and why I underlined this, is they just gloss quickly on the missed medical appointments or treatments, and that's it. But there are many other reasons why, and important reasons, such because they're directly related to the actions of the government, which was to shut things down and close things off. So we've got the missed medical appointments, but you also had hospitals closed, so people are basically surgeries rejected that were not non-essential, and so therefore people were missing those treatments. We had suicide, stress from job loss, abuse in the home. There's all sorts of areas where we've had problems kind of poking. It'll be interesting to see how many of those arrive, but I think that needed to have more light shone on it. It's more than just the medical appointments or the treatments. So since the beginning of May, the number of deaths has declined to expected levels. So that's back in May. May to June. So by the end of June, or sorry, by the end of May, starting in June, we'd be right where we expected to be. Well, how can that be in the middle of a raging pandemic, as we're told, and we're going to die if we do this and don't do that? If you don't wear your mask, bad things are going to happen, and you're a grandma killer, blah, 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 blah. Well, how can that be when this, it can't be. So here's the big sentence here right at the top, the title: most provinces and territories have had no clear evidence of excess mortality because of the COVID-19 pandemic. Really? So other than that bulge in April, there has been no real excess, really, in a pandemic that's going to kill us all. How can that be? So at the country level, the only conclusion we can come to here is, despite the constant stream, I guess I shouldn't say only conclusion, but my conclusion that I've drawn from here is, despite the constant stream of blather from the corporate media, particularly that of the CBC, which is now a full-fledged state broadcaster and propaganda, there's no doubt about that, and the government talking heads, there is no data suggesting any emergency requirements are required at all. It doesn't exist. It only exists in the minds of the government, who are trying to push it down to us for whatever reason they've got going. What is required, however, is a full-on independent inquiry to all of the actions taken by the current federal government group to date, and this does not rule out criminal charges and lawsuits. Moving on to province of Ontario, get a little closer here. This is basically from their press release the other day, the speech they gave the other day. The latest trends in numbers have raised some concern, especially as we begin to reopen schools and post-secondary institutions. That is why, based on the advice from the Chief Medical Officer of Health, good, we can deflect blame on that if we want to, or responsibility, as the case may be, and the Public Health Measures Table, whoever they may be, we will be taking a pause of 4 weeks or 2 2-week cycles of the virus before considering any further loosening of public health measures or further reopening of businesses, facilities, and organizations. We did not make this decision lightly. Taking a pause in further reopening at this time will help us to avoid returning to broad-scale closures and shutdowns. And on this, the first day of school for many young Ontarians across the province, we need to do everything we can to limit the spread of COVID-19. The best way to keep our schools safe is to keep our community safe. A couple of things before we go further. It may just be me, but her expressions were kind of creeping me out, because she had some giggles going. Like, it was just weird. I don't know, just the way things she was giggled at were just kind of creeping me out. And these people have given press after press after press after press after press, so there's no way we can just quickly dismiss it and say it was nervous. Anyway, but that's just mine. I also wanted to make a note here of this sentence: taking a pause in further reopening at this time will help us to avoid returning to broad-scale closures and shutdowns. There is no indication that those are necessary in the first place. There is no reason to say this unless you wanted to plant something in the mind. There is none. There is nothing that would then indicate this. So you're either covering your political butt, or you're trying to plant some sort of narrative, but there is no need to return to broad-scale closures and shutdowns. There's no data supporting that would ever be the case at this point in time anyway, so why are you saying this? So it's, kind of interesting here why this would come out, but that's for another day. Let's get into the data. So this is just a little database interface that I wrote on the front end. I'm missing the bottom right corner there, which is the fatalities, long-term care. The province of Ontario changed their data, the way they stored it, and I just haven't got that table fixed up yet, particularly. I do have it at the region level, but not at the province level. But this just gives us a quick summary here in the numbers of where we're at. So we had a total case of 536, basically a 90% recovered rate, and then the active cases are still 4%, and then 6% is the total fatalities. So on the surface, that 6%, you're thinking, ooh, that's pretty high. However, keeping in mind, over here, we have 5,540 of this, or in long-term care facilities, and in those facilities, 1,848 fatalities. So here we have this total fatalities, but we need to subtract this because these folks, again, do not circulate in the general population, and they are in the high-risk group at the same time. So if you take this out, suddenly this percentage here drops pretty dramatically, similar to what we saw before. We're going to do probably about a half, about 3% or so. The other interesting part here is, look at this, 33%. So even if you are in the high risk, and even if you are in long-term care where the bulk of fatalities happened, you still had a 67% chance of recovery. So 33% chance of death, but 67% recovery. So in something that, you know, is a killer thing that's going to kill us all, and yet even in the vulnerable population that got hit, they still had a 67% chance of surviving too. So yeah, come on. I mean, really, your data is now falling apart and it doesn't make any sense. The other interesting thing to note is that in terms of the cases breakdown, we can clearly see the higher number of cases in the lower age groups compared to here, but yet we can also see the dramatic difference in fatalities where the higher fatalities in lower age groups. So that pattern bears out also with what we are seeing. So back to the province's site, they do things in two ways. They have the episode and the reported, and I've got the definition coming up a little bit, which I'll explain. I prefer to do the episode if I can. As you'll see with the definition, it kind of gives us a better idea of what's happening. The reported then can give us a different kind of look, because this is basically when they're reported to the health department, but that doesn't necessarily mean that's exactly when things happened. They could be back here. So we need to get as much of an accurate picture, and so therefore we can see where the episode date tends to give us a more even keel, and it just makes more sense that we would use it. So the field uses a number of dates entered into FIFAS to provide an approximation of the onset date, whereas the reported date is just the date that it arrived at the local health unit. So if you're bulking up, if you've got labs doing some of this testing and they are only submitting every 3 days, you know, things like that, that's where you end up. It's a weekend, those kind of things. So we end up with these spikes and weird things going on, whereas with the episode date, it tends to even that out to give it a more accurate look at it. So now we go to the deaths here, same chart, it's just you can switch whatever. So I'm going to zoom in a little bit more. You can see here I just slid this down because you can slide this down to the end. So this is the number of deaths in Ontario, and we see the bulk of that happening here. Interestingly enough, we were in our shutdown right here, and so we should have seen a dramatic drop off right about here, even if you gave them 6 weeks down here, but oops, we did not see that. Take that with what you will. But what we can see here too is this matching what was talked about in the federal doc and how it evened right out, and then it basically has just gone straight down into nothingness. Now notice the scale on this side as well. We're not in the hundreds anymore, we're in the tens. So these little blips here represent 1 and 2 and 3, like not tens and hundreds. This is virtually nothing. So back to, you know, Christine Elliott's comment about this whole, oh no, dire straits. Well, no, we're not at all. That same graph, the weekly death counts, exact same thing, but it's just in the province of Ontario, and you can see the same kind of pattern manifesting itself. And I again reckon that this is going to go, you know, something is going to adjust once they get it going. So let's look at some of these fatalities now and see what it's all about. So I've sorted here by the episode date, and basically that can give us a nice chronological back here, but look at the patterns here. So other than this one, it would be interesting to know if there's any underlying data, like underlying conditions or comorbidities. Canada doesn't seem to be reporting that. They should be. It's a critical component to troubleshooting, to finding out what's going on here, and it's public data. So, you know, there's no privacy issue whether you're a number. It's not even reflective of any number. It's just an ID number that's randomly given to you. And I mean, we can't tell anything from, look at that very first case there. Can we tell anything about that other than the fact that it was in Toronto or at the Toronto Public Health, which is a pretty wide-ranging. They were in their 40s, which could be anywhere from 40 to 49, and somewhere in that time frame they passed away. That's the only thing we know. Well, in a population of how big is Toronto at that area? A couple of million anyway? Yeah, that tells us nothing. So to actually have the field in there that would say, yeah, comorbidity 1 or 2, or 1 condition, 2 condition, 3 conditions, so on and so forth, it doesn't violate any sort of privacy whatsoever. So that excuse is bunk. But let's look at these again, where we're at. Outbreak, which defined by the province is 1. So, but these are all limited to, I checked the background. In Ontario, there were only 7 healthcare fatalities in long-term care, and the rest were all residents in there. So anything that's outbreak, I couldn't find any children, I couldn't find any prison stuff, although that has been published now too, so I'll have to look a little closer at that one. But for our intents and purposes here, I think it's fairly accurate to say that the outbreak is related to long-term care. And so, you know, the age kind of backs that up as well. We're not going to have that in the youth shelter. So here we have, you know, 90s, 80s, this is outbreak. Couldn't find any connection here, but still in the high risk group, potentially in the 60s, because that actually could be 69. We don't know. And back to the 90s, outbreak, no link, but here we have 80s, 70s. So here we have an outbreak at 40s. This would be interesting to know how that's connected up, whether that's an employee, 40-year-old in an outbreak facility. However, that could be in the hospital or something along those lines as well. But now look where we are. We're back into July 20th, and further back and further back and further. Like, we're going all the way back to the 9th of July, and we still really have everybody in the high-risk group except for a couple. And that's it. And you know what? You're going to shut the thing down. You're going to threaten to stop. You're going to stop your... I mean, this is absolutely ludicrous. It's just astounding. And it has to end, because it's just not justified. And they have no rights to do this. We've got to go. So just for fun, fun's not the right word, my apologies. Just for a different look, I removed Toronto here because Toronto is, it's dense and it's a higher population area, and it just gives us another idea of how these look. But in terms of the patterns, they don't really change all that much, although we can go further back now. But the pattern still remains the same. Very few of the outside of the high risk. There's a little bit more here, but again, we're including more dates now as we go back. And then there's close contact, that's what that means. But that doesn't necessarily mean that this is a close contact, how, what, where, when. Was that with somebody who was in an outbreak situation? I don't know. But again, here we are in the 90s, which is, kind of expected. So the pattern still remains the same. In terms of the general population, there is no threat, and hasn't been. So let's get an idea as maybe what the fatality rate here is in Ontario on a regular basis. And so if we're looking at 2019 across the top, 2020 down below, these are weekly, and so these are weekly deaths in the province of Ontario. Starting, I had to match them up with what the data that was available, so it was the 12th, 11th, and then the 29th and 27th, although this one does go out to July 4th, I believe, at this point in time. But, if again, in the context of how this was pitched, and then, of course, the actions that were taken because of that context, it was a deadly thing that was going to spread everywhere and was going to kill us all. There's no, you just had to look at the media for 6 seconds and you would gather this. But yet, we don't see huge differences here, right? We do not. This is ridiculous, this is straight out. So there's going to be some adjustments here, absolutely no doubt. Because we're still, tabulating this data, and, 2019 already has at least a year and a bit of tabulation, so I would think 2021 we'll see a more accurate. But unless this changes very dramatically, and in fact in many cases here we're seeing a higher rate weekly in 2019 than there is in 2020. Well, how can that be? I mean, if we're in a raging pandemic, it's going to kill us all, because we're not. It's silly. So let's look at another set of data here that the province provides in just another format. So we can see here, right? Oh, look at this spike here at the end of cases. Again, as we're going to go down through when I look at the testing, we need to get away from this idea of a case being a terribly bad thing. A case just means you tested positive on one of the tests. It doesn't necessarily mean anything, because some of those tests are inaccurate. They have high false positive rates, but they also trigger on very minute amounts of DNA material, or in this case RNA material. Therefore, you are no danger to yourself, to anyone else, or anything. You would not even know anything unless somebody did this test to you. And it came through, and again, you're relying on the accuracy, which has been shown to be less than stellar. So we need to think about positive results or positive tests versus cases, because this is what they're using, is cases to determine the narrative and to keep us scared and in fear. Oh no, more cases. Yeah, well, if somebody is totally non-transmissible or even non-infectious to themselves, that's a case of what? It's a case of mistaken identity. That's what that is. Or a case of, well, let's save that for another day. So let's look here so we can see where we have this little spike. So now, okay, well, Christine Elliott, I can see why your little spike there. You've got the last couple of weeks here. We've got this, so it's basically right about here would be August, somewhere in this neck of the woods. Okay, but look at this. We have an increase in testing right around the same time. Oh, gee. Because guess what happens? If you test more people, the chances are you're going to have more cases. This is just common sense. Let's even look at the numbers. Here they are. That's the exact same chart. All I did was change it to a table. But look at the increase here. Well, no wonder we have a spike. Now, there's a day lag here, but this here may correlate with Labor Day, depending on how far behind they are, because Labor Day was, I believe, in here, and this is kind of middle of the week. But it's interesting. There's 3 days, and there's Saturday, Sunday, Monday in the long weekend. So there's a possible potential connect up here. But other than that, look at how we've increased the testing, and a steady increase in testing. So of course we're going to have a higher number. Well, you have to have the same rate of tests, period, right? Again, the testing is just not going to work really well to give us beyond a rough idea because there's just too many variables. But we can clearly see if she is basing her decision to do so on this, then she is again being disingenuous, which they have been since basically the start of this whole entire thing. Here's what matters, the deaths. And again, different view, same data, and we can still see where it drops off and then drops off, and in a couple of cases been readjusted because these are actually negatives, and basically to nothing right up to here. So I get where it's a lagging indicator, but still there's nothing to justify here, and the fact that we've got an increase in tests at the same time you have an increase in cases, well, there's a correlation there, and there's a good strong case to be made for causation as well. And so here we have the total deaths over time, and we can see exactly where they peaked and flattened out and then have stayed essentially flat. Nothing at all. So there is no justification, none whatsoever. Despite the constant stream of blather from the corporate media and government group talking heads, there is no data suggesting that any pause in reopening is justified. Further, the data also shows all restrictions imposed by the province need to be lifted immediately. What is required, however, again, a full-on independent inquiry to all the actions taken by the current provincial government group, and particularly with regards to long-term care. And we cannot rule out criminal charges and lawsuits. Let's move a little near and dear to my heart here, the Waterloo region. So this is where because of the region I got this part fixed up here. But the same thing applies. We've got total fatalities with a large number, but when we take long-term care out of it, we'll end up with this being, well, I'll show you. 332 cases in long-term care, 95 fatalities long-term care out of a total of 120. That leaves us with 25 fatalities. I mean, this number then drops to 1%, 2%, 3%. Same pattern here. We're roughly 30% chance of passing away, 70% chance of surviving it, even in the high-risk group, even in the long-term care facility. But yet a disproportionately high percentage of fatalities amongst the general case group. Redonkulous. So we're looking here at the same data set now. We're just shifted it to Waterloo region. And again, they do the same thing with the episode and the reported. In this case, there's not a whole bunch of difference, but of course our data set's a lot smaller because we're only about 618,000 here. There's only about 618,000 in Waterloo region. So the data set's a little bit shorter. So that makes perfect sense there. But look at this. This is where the mask mandate went in. They were already low. They already had been declining, and with, again, a couple of spikes, which probably could be, and of course, note the numbers here. This is, again, not hundreds or thousands. This is tens. So these spikes represent an increase of 1, right? So we were already on the way down, and yet here's where the mask mandate went in, and yet here we still have a steady stream. So clearly, it's not working either. Now, of course, they'll just blame it on people for, there's still enough people out there not wearing, they just come up with some concoction. It's just ridiculous. They, in this case, being many of these screaming harpies that decided to take on the world on the, anyway, for another day. So this is the reported. We can see there's not a whole heck of a lot of difference here in terms of it. But let's look at the fatalities here. Boy, oh boy, oh boy. So notice the scale has changed. So this is 1, 1, 1, 1, 1, 1, 1, 1. So since the middle of May, 1, 2, 3, 4, 5, 6, 7, 8. 8 fatalities since the middle of May. And Waterloo region has a mask mandate on transit, a mask mandate indoors, and has thrown a mask mandate or projected their mask mania onto the children at junior kindergarten all the way to 12 have to wear masks in school. Absolutely ridiculous, astounding, absurd. It's just insane. And this was some of the justification that was used to do so. Really, such hypocrisy. To give you a little bit of a context, and it makes more sense. In fact, I'll hold off onto that until we actually see that data. So let's look at what these deaths are. Oh, gee whiz, it's the same thing. Here we go. Now this one I've sorted here by reported date, but there's not a whole lot. Again, smaller set, so we're not that far out in terms of the matchup. So it was okay in this regard, although I do prefer the episode date. So yeah, 70s in the outbreak-related close contact, but they're in their 90s. 80s, couldn't find a link there. Close contact in their 70s. Outbreak, again, long-term care. In the 60s, 70s, so again, back. So now we need to find somebody in the general population all the way back here Is that the only one? Yeah. So in the general population outside the high-risk group, again, we don't know. This person could be 69 or they could be 61 or 60. So that's a bit tricky on that one. But look at how far we have to go back. The 29th of April. The 29th of April to find somebody in their outside, it was an outbreak. And there are no staff that I could find and recorded of any healthcare fatalities. So that would have to be a resident in their 50s in an outbreak. Oh, of course. So now what about general? Now we go back here. So is there any? Was there any in here? Yeah, you go back to the 21st of April-ish, and you'll find one. And here we have all of what I've described before, and based on that data. So this was interesting. This just showed up when I was looking for something else and just putting this whole thing together. University of Waterloo professor calls pandemic COVID fake emergency. So the article is interesting. I recommend that you take a peek at it anyway. But it was this bottom part that really interested me in terms of the context of the presentation here. So notice the drama here. Since the start of the pandemic, there have been 1,480 cases of COVID-19 and 43,685. Who cares about this? This is a story about a professor at the University of Waterloo. Why do they need to include this? Well, it's very dramatic and it clubs you over the head because these are the things you're going to remember, these big numbers, right? So if you click here, it takes you to a page that's got some data. It still doesn't really break down the data per se, and then it's got some stuff that's swiped right from the region's website. So it really doesn't give you an in-depth, which the press should be doing. However, CBC is now a state broadcaster, so they will never do any of that. And away we go. But we're going to do it right here and now. So I'm just doing using a query tool against the same data that I showed you previously. And so this is the same database, and it's just querying it in a different way. So I'm going to select a count of the row IDs, just give it a name here, total fatalities, and this is my table name from the raw data from the province. I just connected this in because I like to have numbers to connect them instead of just the words, because special characters and spaces can cause problems. So I just created another table and put all the regions in that table, and that's how I connected them up. Where the region ID then is 24, that's how that worked out in that table. It was Waterloo region is 24, and the field outcome is like fatal. So I could actually put a equals there, but basically it has the word fatal in it. So it's got fatal, resolved, and active, I believe, or unresolved. I have to take a peek at that. But fatal is the one that we're in. There's only 3 designations in there. So that matches up what we saw before. There's 120. That matches up with directly on the region's website as well. So we have 120 fatalities total in Waterloo region since January 1 attributed to COVID-19. And keep in mind, again, a population of 618,000 people. This is a statistically insignificant, but it gets worse. So let's drop this down here. Outbreak related is null, meaning so anything outside of long-term care. Because again, the way their data was presented, the only deaths and fatalities in Waterloo region that were outbreak related were long-term care. Nursing homes and retirement residences. So I'm saying if this outbreak related, it's one of 2 fields in this one. It's either a yes or a null. And so I want the ones that aren't. That leaves us with 25 outside of the long-term care. 25 fatalities. Let me remind you, 618,000 people here. Let's even take out the long-term care people and the high-risk group and just say a quarter of that 618,000 are that group. Let's subtract them. So, I don't know, 525,000 people. So 525,000 people in the non-high-risk group and non-long-term care, and of that, 25 fatalities. And again, I gave you a list of things that have happened here for 25 fatalities. If you thought that was bad, it gets worse. Outside of long-term care and outside of the high-risk group, so that's less than the 70s, how many fatalities do we have here? 4. So just in case that number is too small, 4. Just as a reminder, 4. In a region of 600 and, what did I say, so we'll go 525,000 people outside of long-term care and the high-risk group, and we've had 4 fatalities. We now have masked up kids. I'm going to go on here. So let's summarize. Of the 120 recorded COVID-related fatalities since January, 95 were in the long-term care system, leaving only 25 fatalities in the general population. Further, if we remove the high-risk group from the equation, we are left with a grand total, oh, nice typo there, Todd, of 4 fatalities in the general population since January. Waterloo region, population 618,000, but keep in mind we can even use that other number, it works just fine. It's 525, it's still just as ridiculous. Had businesses destroyed, commercial and social services disrupted or outright canceled, individuals denied surgery, causing deaths, all sorts of nasty things going to be coming out of that. Economic destruction. Indoor mask wearing mandated against an atmosphere of fear, and now unbelievably projecting the mask mania onto K-12 students because of 25 fatalities in the general population since January, and then we take that subtraction out there, and we end up with 4. 4. Do you believe it? It's insane. Man. Anyway, this is their list of long-term care facilities in the region, and this is from the region's website. There's 41 in total. Let's look at these a little closer. In addition to this, we also have what they would call in an institutional setting or a outbreak related would be classified in these. So we've got food processing, manufacturing, congregate settings would be group homes and shelters, that kind of thing. We've got child care summer and then hospital outbreaks, but you can see there are no deceased in any of these, so all the deceased are within long-term care. Let's look at this here. 1, 2, 3, 4, 5, 6, 7, 8. So in 8, because that is the last fatality. So of those 95 long-term care fatalities, 70 of them were in 2 locations, and all the fatalities confined to 8 facilities out of 41 in the region. This is atrocious. Absolutely astounding and atrocious. And particularly 70 of them, and that is actually over half of the fatalities in Waterloo region were in 2 long-term care facilities. That's ridiculous, and it absolutely needs to be investigated, and whoever is responsible needs to be held accountable for that. So a region-level conclusion: despite the constant stream of blather from the corporate media and government group talking heads, there is no data suggesting that any restrictions whatsoever are justified in Waterloo region. And as usual, what is required, however, is a full-on independent inquiry into all of the actions taken to date by the current regional government group, including the possibility of criminal charges and or lawsuits, for sure. So let's rewind a little bit from a previous video I did talking about the tests. In order for the statistical data to be dead on balls accurate, thank you, my cousin Vinny, we would have needed to begin testing everyone in the province early in 2020. We would have had to continue testing either every day, same time of day and same test, or every 14 days, because that was their time frame. It's turned out to be around 8 now. Should perhaps there's credence to the incubation period, so every 14 days. That's just bad grammar there, but basically just in case there was credence to that theory. This is not the case, nor was it possible to do in terms of doing the testing. So then we're left then with patternistic testing and versus random versus the entire population. So while this can provide some insights for sure, it's also open to interpretation and manipulation. So we need to think critically when we're talking about these testing, because again, how many of us have actually seen them? None. Right? Majority of us have no idea what any of these things do. So this is from the CDC. This is basically attached to their testing. It's interesting how they talk about viral tests, which the PCR test is not actually a test. To tell you if you currently have an infection, well, it doesn't really tell you that either. It just tells you that there is some genetic material that they think is connected to the SARS-CoV-2, right? So you be careful of the language. You just have to, the more you know, the more you will be on, you'll be able to recognize, the more you have your shields up for this kind of sneaky language. But the PCR, and you may or may not have heard that, but that's the most common testing for current infection, as they say. And it's not really a test, it's a diagnostic panel, and it's intended for the qualitative detection of nucleic acid. So it doesn't detect any virus, it actually detects RNA in this case. And it just does basically whether it, they can read it as RNA and it's not just some glob of goo. So it's not even a qualitative, right? Quantitative. It doesn't tell you the quantity, which is a big deal when it comes to viral infections, because the more bigger the viral load, the more infectious you are to yourself and others. So, it doesn't even do that. So A, it's not testing for the virus per se, it's just testing for RNA they think is associated with the virus or connected to it. And B, it only tests for the quality, meaning can I read that and can I say, okay, that is that RNA, or does it look like a big pile of goo? It doesn't test for quantity, big problem. Further down here, we read positive results are indicative of active infection with 2019 nCoV, but change all the names all the time, but do not rule out bacterial infection or co-infection with other viruses. So it might be something else that's triggering it as well. The agent detected may not be the definitive cause of disease. So lots of room for interpretation and problems here. Absolutely. And so therefore, we really, even at this level, the beginning basic level, we need to start being very skeptical about the testing idea and whether they actually work. So what are these cases? Well, as time has gone on, it's clearer that cases just mean you've tested positive. It doesn't mean anything else beyond that. There are other things that have to happen or occur before anything can go. So the testing idea is just a silly name. Moving on here, the second one is the antibody test. I actually think these are starting to fall by the wayside because of their inaccuracy, but the idea is that these are supposed to test past infection. So if you've got antibodies in your system, this will pick it up. Again, the language here, if you need a viral test, this click here takes you back to where we just were, and it's not a viral test, and it even tells you that it's not a viral test. It actually just picks up RNA, nucleic acid, right? And virus tests identify the virus in samples. They don't identify the virus, right? They identify what they think is RNA from viral activity. That's what that means. So there's a difference there. Even though it seems like splitting hairs, it's not. But let's get to the meat of the matter here. If you test positive, a positive test result shows that you may have antibodies, from an infection with the virus that causes COVID-19. However, there is a chance a positive test result means you have antibodies from an infection with a virus from the same family of virus called coronaviruses, such as the one that causes the common cold. Well, this can be a big problem, can it not? If the common cold that I had back, X amount of months ago is actually triggering a positive, I mean, seriously. So I have to follow up here and see how much these tests are actually being used anymore. The PCR still is, but certainly not that one. It may not be. This is a disclaimer from the bottom of one of the provinces, weekly or daily. They put them at the bottom of both of them, so I didn't include the thingy there. It's in the other link. So lags in IFAS plus data entry due to weekend staffing may result in lower case counts than otherwise be recorded. So we saw some of that in the terms of the patterns, weird spikes and things like that. And that would make sense if you're, weekend staffing. And as things have petered out, I've noticed at a few places, they're not updating as much as they did before either because there's no reason to. Nothing's happening. Gee whiz. The next one here, the number of tests performed does not reflect the number of specimens or persons tested. More than one test may be performed per specimen or per person. As such, the percentage of tests that were positive does not necessarily translate to the number of specimens or persons testing positive. This is good to know as well. Here's a, over-the-top, ridiculous, simplistic example, but it makes the point. If you have one person who goes in for a test and they test positive, now you have one positive test. If you have that same person going in for the same test, the same person, and they test positive 10 times, now you have, in the way that we're recording this, now you have 10 cases. But the reality is that it was just one person, not 10 individual people. And so that's something to keep in mind. Here's an article from the certainly the establishment rag, the New York Times. You got to be very careful reading this newspaper because there's all sorts of shenanigans going on there. But nonetheless, when they're quoting other stuff that can be verifiable, then it gives it a little bit of credence. And this article's got some interest to it as well. It's the numbers that, and the point here they're trying to make that's very important, though. Some of the nation's leading public health experts are raising a new concern in the endless debate over coronavirus testing in the United States. Standard tests are diagnosing huge numbers of people who may be carrying relatively insignificant amounts of the virus. That is very important to know. So here's how that thing works, that PCR. The PCR test amplifies genetic material, genetic matter from the virus in cycles. The fewer cycles required, the greater the number, or the greater amount of virus or viral load. The greater the viral load, the more likely a patient is to be contagious. That just makes sense even without knowing anything about biology. If it's contagious or can cause infection and you have more of it, then it stands to reason that you have a bigger chance of being contagious as well as getting sick yourself. But it basically takes that small amount and amplifies it in cycles. So if I can't find it, and this is where the problem comes in, well, how many cycles does it take? So if I found a whole bunch in one cycle, what does that mean versus if I found nothing in the first 25 cycles and then one thing in the 26th cycle, right? This is a big problem, a big problem. Is the other part here is the number of amplification cycles needed to find the virus, called the cycle threshold, is never included in the results sent to doctors or the patients. But then you would really want to know that, wouldn't you? But anyway, you would think so. In three sets of testing data that include cycle thresholds compiled by officials in Massachusetts, New York, and Nevada, not a bad sampling, I would think. New York is densely populated, highly populated. Massachusetts a little less so, and Nevada a little less than that. So it kind of gives us a good broad segment. Up to 90% of people testing positive carry barely any virus. So essentially, if you're saying carried barely any, then you are not non-infectious, and you're not going to get sick yourself. Period. Now, could that grow over time? Potentially, absolutely. On Thursday, the United States recorded 45,000 new coronavirus, and so they just wanted to take the 10% off, or the 10 times, minus 90 there. Interesting here in the bottom, submit to contact tracing. You have to drop that stuff. I mean, this is how they slip all this stuff in here. Contact tracing, there's no, go away from me. This is brown shirt stuff. This is, go on. If we had a real live thing going on, so say this was exactly what it is, except it had all of the mortality and other statistics and patterns and behavior of Ebola. You wouldn't need any of this, because people would be freaking out, and rightly so. We would know. You wouldn't have to have any contact tracing. You wouldn't have to run around chasing people. They'd be happy to give you that information, because that is a killer. Black plague back in the day. It's treatable now, but back in the day, it's the same kind of thing. That's why a virus was used. That's why it causes so much panic, because well, that and many other things. So, one solution would be to adjust the cycle threshold used now to decide that a patient is infected. Most tests set a limit at 40, a few at 37. This means if you're positive for the coronavirus, if the test process requires up to 40 cycles or 37 to detect it. So look how far you have to go to detect even a little bit of it. And you have to, and these are, the cycles are exponential. So by the time you get to 40, I can't remember what it was. It was 10 to the 12th. It was a huge number, ridiculous number. So if you have to go this far to even detect, anything below that, it's just, anyway. Tests with thresholds so high may detect not just live virus, but also genetic fragments, leftovers from infection that pose no particular risk. One point I want to make here, the virus is not alive. It's not a living thing like a bacteria or anything like that. Live just means it can infect, and what that means is it's got a, because the virus is essentially a protein shell or protein jacket with DNA, or nucleic acid, DNA, genetic material inside, and it replicates itself, but it needs that protein shell to get into a cell and to attach and to enter in. So if the protein casing or shell is not present or damaged or whatever, then the thing is useless. It's not live. But in terms of living, it's not a living thing. It's just a replicator, and it can either replicate or it can't based on whether that shell is present or not. And so here we come to a big problem. Even if you thought the other one was big. The Food and Drug Administration said in an emailed statement that it does not specify the cycle threshold ranges used to determine who is positive, and that commercial manufacturers and laboratories set their own. So anybody can have their own agenda and change those dials up. I'm going to use 2 and I'm going to use 32. It doesn't make any difference. Well, that's a big problem for the integrity of the data. Holy cow. So through reading that article, I came across this, I think it was referenced in the article, this paper, and it's an interesting read, although it is a paper, so it can be a little dry, I guess would be the word. But this stood out, which was interesting, especially when it comes in context of the masks, and of course the pitch that it's, which was quite clever. This is the mask. It's not self-prevention, but it's to prevent others. So it makes it easy then to put the blame on other people and get people to do your dirty work by calling everybody a grandma killer and going crazy. But this speaks to that because it talks about aerosol transmission and hanging around in the air, or being, hanging around the air and then dropping onto a surface and somebody else picking it up. So 2 possible positive cultures were obtained from 95 environmental samples in one study that assessed the aerosol and surface transmission potential of SARS-CoV-2. Zhu and his colleagues reported on samples taken from 7 areas of a large London hospital. Despite apparent extensive air and surface contamination of the hospital environment, no infectious samples were grown. So they couldn't actually even cultivate anything off of that, which again flies right in the face of what you're being told about the masks and stuff, and actually just shows that again, remember, there is no peer-reviewed evidence, and if the burden of proof is actually on the mask people. So anybody who's pushing a mask, the burden of proof to prove that we need them is on them, not on the rest of us, because we're not born in that. Our natural environment is no masks. We don't put one on when you're birthed immediately, and so on and so forth. So the burden of proof is on the other side, and of course they don't do that. They just throw that up and then get everybody else to do the dirty work. Oh, you're a bad person if you don't wear a mask. That's irresponsible. You're bad, nasty. Well, here's a little bit of data, and again, like I said, there is no peer-reviewed data that says a mask wearing on either side will prevent SARS-CoV-2 infection. None. This was also interesting where it talked about, I mentioned there before, about the 14 days, but this is actually 8. This is 3 different ones where they actually came to the conclusion that 8 was the limit. This was also interesting too. The evidence is increasingly pointing to the probability of culturing live viruses related to the amount of viral RNA in the sample, and therefore inversely related to the cycle threshold. So if I have to keep cranking up the cycles just to get a positive result or a positive test, that's a problem. Thus, the blanket detection of viral RNA cannot be used to infer infectiousness. So essentially, those tests are, for all intents and purposes, guidance only, but shouldn't be made to make decisions or one way or the other, or any sort of conclusions drawn from them. I wanted to include this to remind myself to mention it here, that study paper was not peer-reviewed as of yet, and that's important. That peer review just means that their claims can be recreated, substantiated, and their methodology is sound. So it's important that all papers get a peer review if possible. So I just wanted to mention that on that one. This was something else that came out March 24th, and I'm running on my time here, so I want to start talking a little bit faster. So essentially what they're saying here is that on your death certificate you may have COVID-19 or whatever they're going to put on there, but you may have died with it, not because of it. Well, that is a big difference and a big problem. And as we saw, there's further down on this page, there's some, attempts to put in some checks and balances. Clearly, they weren't going to work. We could guess that, and did back in March. But as the summer went on, we could clearly see, as you got people with motorcycles, you got all sorts of stuff being attributed that aren't even close. There was one person was sent a positive test. It was on the news. Actually, it was on one of the news channels, one of the mainstream medias. His mother, was sent a positive test result. Actually, she died, but not only did she died before this even started. She died back in February, and she got a positive test result in June that she had COVID. And it actually, I think it was dated about 3 to 4 weeks after the actual test date that was on there, which was way before and she had passed away way before. And the stories went on and on and on and on. But there's the bottom line, and it's the same in Ontario as well. This is from that same bottom stuff at the bottom of their weekly and their daily. Deaths are included whether or not COVID-19 was determined to be a contributing or underlying cause of death, as indicated in the IFAS field. So you either died with it or because of it. But we don't put any difference in there, so we just add the deaths on there. Well, that's a big problem. I mean, good gravy, man. Wow. So I want to get to the kids, because this is really ticking me off with these mask mandates in the schools, because this is a problem. Now, in my head, I'm thinking, well, people will counter that with saying, do you have any kids in the school system? And I would answer, no, not at this point in time anymore. And so then you don't have any skin in the game, so how can you complain about this? Well, I can complain about it on a moral ground for sure, but I'll tell you what, I'm not that old yet. So as the generations are coming through, I will have to live in the same world that these people are coming out of, and we are destroying them right off the get-go. So yes, I do have some skin in the game, and so does everybody else who lives in the same area where these practices are being mandated. It's absolutely ridiculous. So, kids are going to be distrustful of each other. They're going to be fearful of each other. They're missing out on the opportunity to learn from the 10 million facial muscles and expressions that people have in their faces. They can hardly hear because of the masks. Like, on and on it goes. You're told to stay away from your friends, and on and on. It's ridiculous, and it's sad, and to me it's child abuse, straight up. But let's look at some data. So basically, I took the query here, and I wanted to know anybody who's under 20, and of course, this is it. You can't get specifics. I sure would like to, and they have to be somewhere. I just don't seem to see them publicly. So it's less than 20. That's the best I can do. And the outcome was fatal, and the outcome was not fatal. And then ordered by the reported date. Again, the dates weren't a big deal here. I was just looking for the count, so I would have gone with my episode date. So again, we're like the less than 20 age group. The outcome is not fatal, and the reported, that's it. So there's the criteria, and look how many records they come up with, 2996. So essentially 3,000 cases since the beginning in the age group of under 20. Again, I don't know how many children there are. It would be nice to know. However, it doesn't really matter, because here's when I change this to like fatal as opposed to, so basically it equals fatal and not 1. And that was in Toronto, and that was back in June. 1 fatality of that group, and we have masked up the kids. We are scaring the hell out of them. Fear, mistrust. You're sterilizing classrooms, and I mean not just in terms of cleaning them, but all the cool stuff has been removed. The things, the environment in there. So basically, you're breeding automatons now who are scared of each other, and it's sad. It really is sad, and there's no justification for it. And here we have one. And yet, you look back in 2009 in H1N when that disproportionately affected the other end of the high-risk group, and that was the lower ages. And yet, we didn't hear any of this stuff going on then, did we? No, not at all. So why now? I see. So here's Waterloo Region. Wearing a mask helps prevent the spread. Prove it. You can't prove it. This is absolutely a straight-out lie, because they cannot prove this. There is no peer-reviewed papers that prove or show or even indicate that wearing a mask, you or anyone else, prevents the spread of COVID-19. None. And it may sound like I'm being very specific there, but you have to be, because we're talking about a specific thing that's being in a broad sense, but it's very specific. We have to be specific about this. I hardly say specific, so many specifics. So this is straight out. You can't, this is ridiculous to say this because it can't be proven. And this is from an educational institution. Good gravy. So here we are for students in junior kindergarten to grade 12, non-medical class master required. Basically, unless you're in the field, anytime on school property until you get home. Like, that is absolutely brutal. There's absolutely no justification for any preventative measures beyond the usual that you would normally have in any school. Given the data at hand, it is not possible to conclude that these measures are about public health now, but rather they are political in nature. There is nothing to do with health here whatsoever. And that's across the board, not just with the kids. Mandatory masking in the absence of verifiable need is tantamount to child abuse. That's my opinion, but I'm sticking with it. With the primary responsibility lying directly at the feet of all layers of government, however, hard words ahead, parents also have a responsibility here. Absolutely, because if you're sending your kid to school in that environment, then there's a responsibility there as well. Again, hard words, but it's absolutely a reality. So as we wind down here, I'm down to my last couple of slides, and I'm going to make it here under 20 minutes. No, I'm not. But I tried. Trust your gut. So I've done this before, and I asked around, and I've done a lot of asking. I'm not the only one. Many others are asking the same question. But let's do this. Trust your gut and ask the question of yourself and others around you. You can ask family members, ask them to ask, and so on. Of you and your immediate family and friend circles, and I'm not talking about, Mary down at the office who knows somebody who's brother's whose sister, or Jim the insurance dude whose brother's, just your immediate circle. You could include sister-in-laws and daughter-in-laws and son-in-laws and those mother-in-laws and those kind of things, because they are kind of a direct connect. But beyond that, that's the end of it. And then ask how many have been hospitalized or experienced fatality or, I guess you wouldn't have an or, but or tested positive due to SARS-CoV-2. If you're like most I've talked to or have commented online, the answer is very few to zero, and the actual answer is more like zero. So many folks have none. They don't know anybody, nothing at all. And then you compare that with colds and flu at any other year, right? So any other year, colds and flu, you're well aware because people in your circle have the colds and have the flu, particularly the flu, because that can lead to pneumonia, and that's a good comparative one here. And we have lots of people. I think it's very rare that anybody would go through a winter without knowing somebody in a close circle. Again, not married down the aisle, not in a broad sense, but in a close circle, would know somebody with the flu. So here we are. Once again, we are allowing a small group of individuals to dictate and direct our lives. And in the case of the so-called pandemic, not only are we allowing the small parasitic class to drive the train, we're also allowing a small group of screaming harpies to do the same. Those terms are accurate. Parasitic class, if you study how government corp banking works and acts, you'll see clearly they are parasites, and so they're called a spade as it were. And the screaming harpies, well, based on what I've seen and witnessed personally as well as seen online, that's what they are, is screaming harpies. They're nutty. Both in reading online comments and chatting with folks, the single biggest reason given for following the dictates, particularly the mask wearing, is I don't want any trouble. My friends, without your immediate action, trouble is going to find you anyway, and I would reckon that the screaming harpies are going to be the least of your worries when that happens. Stay tuned. I got more coming. Thanks for your time, and I hope you're having a great weekend.